Addictions to painkillers or opioids is approaching an all-time high, and sadly it's also leading to overdoses at an almost epidemic level. So how do you know if you or someone you know might be addicted to opioids, and how do you treat it? Dr. Marc Romano of Delphi Medical Group joins us to talk about treatments and give us a little more insight into what this addiction is. Nice to have you with us.
Thank you.
It's
Nice
a problem that seems to have blown up over a short amount of time. What is an opioid?
Well, an opioid is a type of medication or a type of drug that can be used to treat pain. And
some examples? Common examples.
Oxycodone, Percocet, methadone, Dilaudid, Opana.
So they're common painkillers.
Very common prescription painkillers.
You know, what I hear though about these is sometimes they're prescribed in like numbers that are astronomical, like 50 to 100 at a time, so
Right.
people can start piling up on these and get addicted. Is it easy to become addicted if you're getting a prescription of 100 pills?
Absolutely. In fact, the FDA recommends that doctors only prescribe a 3-day supply in the state of Florida and in most states.
Okay.
However, doctors are now prescribing a month supply.
Okay, so how do you know if you're addicted or if someone you may know or love is addicted?
Most people know when they become addicted due to trying to stop the medication and experiencing very discomfort in terms of physical symptoms of opiate withdrawal. You might feel depressed, anxious, body aches, chills, nausea, diarrhea. You start to feel extremely uncomfortable when you're coming off opiates if you have not been gradually taken off them.
Are there other signs that you might be able to disguise to a loved one, an upset stomach or diarrhea?
Absolutely.
So what are some other signs of dependency that I might be able to detect in a loved one or a loved one could detect in me?
Sure, the classic sign is pinpoint pupils. So when people take opiates, their pupils become very, very pinpoint. So if you see that, you might want to suspect, and given other things in context, that they could be using opiates. A lot of times people will neglect fulfilling obligations, not go into work, not take care of their hygiene.
Start following up. What are ways to break the addiction?
First and foremost is to have a conversation and to confront the individual and talk to the individual, be supportive, and let them know that there is treatment out there, that there is help, and they can overcome it.
And there's no shame in saying you've got a problem, too.
Absolutely not. The number one problem we have in society is the stigma attached to addiction, and we need to break that.
And often a rehab facility can break the addiction in, what, 30 days?
Typically,
what is the time?
Typically, you go into a detox, usually 6 to 7 days, to gradually come off the medication under the supervision of a medical professional. So you taper off gradually and slowly, and then you go into a maybe 28 to 30-day program to really learn the skills to prevent relapse, to build your self-esteem, to work on depression, anxiety, any mental health issues that may underlie your addiction.
Medical stories in the past of people who have broken this addiction have said they were shocked at how much support they received from coworkers and loved ones when they said, this is what I'm doing, I've got to do this. So as we said, there's no shame in saying, I need help.
And I don't think anyone in America has not been touched by this disease. If you talk to people, they have a nephew, a son, a daughter, an uncle, an aunt that has been impacted by the opiate epidemic in America.
Thank you for coming in and making it perhaps more approachable for other people too to discuss this and talk about it.
You're welcome.
Thank you so much.
Thank you.